welcome to Science Notes. And obviously, what are we going to talk about today? But the mystery virus from China. So let's just get straight into it. What is it? And do we need to be worried about it? Well, as you probably already know, it's a coronavirus and it has killed, I think, like 41 people to date, but there's about 1,400 people infected worldwide. So, the virus itself causes a range of symptoms from flu like symptoms through to respiratory problems, breathing issues, lung problems, pneumonia, organ failure, and even death. So far, the World Health Organization said that the cases that they have seen, 25% of those have been quite severe, and 41 people have died. However, obviously, that still means that 75% of the people were fine and have the virus and seem to be fine right now or have even recovered. It's not totally apparent how long a person who is infected with coronavirus is sick for, so I'm not sure how much data we have on the recovery rates. So the reason why it's kind of worth keeping your eye on this virus is just because of exactly that, the uncertainty. We don't know enough about it. We don't know enough about it to just sort of dismiss it and say, it's nothing. And we don't know enough about it to get panicked either. So we know enough that we need to observe and monitor. And it's an ever evolving situation, like literally hour by hour, new bits of information come to light. So obviously, as an epidemiologist, I've been following this for a couple of weeks, really since about January time when we first started to get some real-time data out of China. So should we be worried about it? Is there something about this that makes it more or less dangerous than other viruses? Well, the first thing we really need to think about is the fact that it's a coronavirus. And most of the pandemic planning and the preparedness planning and the business continuity planning done in the UK, and quite a lot of it globally too, has all been modelled around an influenza virus. So that's not a huge issue because a lot of it will be transferable. But certainly I think the first part of it was that we as a global community were probably going to expect a pandemic from influenza rather than coronavirus. So that has implications for stockpiling because you may or may not know that after the swine flu epidemic or pandemic in 2009, they started stockpiling Tamiflu. Obviously, Tamiflu is not going to work for a coronavirus. So all of those antiviral medications that the governments had been stockpiling were all flu-based ones rather than coronavirus ones. However, having said that, they've already mapped the genome of the coronavirus and they're already looking at creating a vaccination. And the first human trials are about 3 months away, but that does mean that even getting it production as fast as possible, you're probably looking at about a year from now. So it's probably going to be kind of end of this year, early 2021, before we even see a vaccination or any kind of antiviral medication. So that's the first thing. The second thing is that coronaviruses do tend to have a slightly longer incubation period than flu viruses. So if you've got flu, you have symptoms within 1 to 3 days. Whereas if you have coronavirus, your symptoms might not show up for 3 to 5 days, slightly longer than flu. Maybe even a little bit longer. Some coronaviruses have like 7 to 10 day incubation periods. Now, the reason that this is important is due to travel and people crossing borders, because if you don't present at an airport with a fever or a temperature or symptoms, then you won't get picked up by a body scanner or by a health questionnaire asking about your symptoms. So people could potentially get through airports, get through borders, and it just makes the spread more likely. So in terms of actually passing this virus around, that's definitely something to watch out for, something to kind of be aware of just due to that incubation period. Whereas obviously if you have a flu, your symptoms are going to start showing within the first day or two, so you're more likely to get picked up at an airport or a train station. The other thing about this incubation period that we don't know, which does at this point make it a little bit more challenging, is just that we don't know if a person is symptomatic while they are incubating the virus. So if a person doesn't know that they have coronavirus, then they can't necessarily stop going to work or stop going to school or stop interacting with their families. And if we are not sure whether or not an asymptomatic person is infectious or not, then that could give a whole 7 days of incubation period the opportunity to infect the people that you come into contact with. Leading on from that, if we start talking about incubation periods and how quickly it will spread, we need to consider the R value. The R value is basically how quickly a virus or an infectious disease will spread. So an R value basically gives us indication about how many people that infectious disease will infect. So if you have a virus that has an R value of 5, then one person who is infected is more than likely to infect another 5 people. Then those people will go and infect 5 people each. Then those 25 people will then go and infect another 5 people each, and so on and so on. So it's about how quickly the virus can pass from person to person and the speed at which it can pass through a population. And there's lots of different factors that can affect the R value, which again is problematic for this new virus, this new coronavirus, because we don't know a lot of the answers to the questions that we need to know in order to accurately determine the R value. So when I first started following this, and they eventually shared an R value, obviously due to the data that they had. They can't calculate that until they have more data, but it was calculated at 1.5 to 2.65. When I went on to the World Health Organization today, they have put that up to about 3.5. So it is ever evolving. The more information that we get, the more data we have, the more things are going to change. So at the moment, it's about 3.5. And just to give you some context, something like measles has an R value of 14. So it's not at the moment presenting as incredibly super quick infectious, but it's equally not presenting as not infectious enough to be not a worry, if that makes sense. So it's high enough to be certainly something to be concerned about at this point. So yeah, R value is something that we need to keep an eye on. The other thing worth noting is that it is an RNA-based virus, and if it was a DNA-based virus, when it replicates, it has the machinery in order to correct any problems or issues with the DNA or with its strands. However, with an RNA-based virus, it does not have that machinery, so there are higher risks of mutation. So that just means that it could potentially mutate quite easily. But that's not necessarily a hugely bad thing, because it could mutate into something like airborne, for example, but equally it could literally mutate itself to extinction. So the mutation factor, although it is problematic in terms of its uncertainty, it doesn't necessarily mean that it's going to mutate and it's going to turn into something super deadly. So those are some concerns. For me personally, I am certainly watching this virus. I certainly think that there is some precautions to be taken. I'm definitely avoiding crowded places and I'm constantly washing my hands. So I would recommend those as the primary prevention measures. But at this point, there's not really a lot more that we can sort of do about it. It's just a case of watching what happens and monitoring the data that we're getting. The other thing to be concerned about, or maybe not concerned, but certainly watch out for, is definitely the mortality rate. So at the moment, it is classed at about a 2% mortality rate. But obviously, just to give that some context, just your normal seasonal flu has a less than 1% mortality rate, but that still kills about 400,000 people a year globally. But then influenza is obviously much more widespread, and there are a lot more people get influenza for that death toll to be higher, whereas there's only 1,400 people being infected with the coronavirus to date. So it's all about proportions. And then the last thing to really consider is exactly how this has been recorded. So in that context, again, we're seeing that there is 1,400 cases, but if a person hasn't been tested at a doctor's and they're just at home with coronavirus, they won't get picked up in the statistics. If a doctor has not diagnostically tested them in a GP practice or a primary care provider, they may not get tested as having coronavirus. They may just be having severe pneumonia or lung problems or respiratory issues or, those kinds of things. So it might be that the symptoms are being tracked, but they're not being recorded as having coronavirus. And obviously that gives us a bit of a challenge when it comes to calculating things like the mortality rate and calculating things like the infection rate. So there are lots of challenges and there are lots of things to be aware of when we are monitoring this new and emerging infectious disease. So this is just my first discussion and update about this. I'm actually going to post every single day, just whatever's new in the news, whatever new data is present on the epidemiological websites. So there'll be a daily update. So if you are interested in keeping up to date with the daily updates on this virus, then please do subscribe, and hopefully I will see you in the next one. So stay healthy, stay safe, and wash your hands.